Hello everyone. Welcome back to our YouTube channel where we will teach each and every fundamental topics regarding the medicine. So, starting with today is January 1st of 2025. I wish you all and your family a good wealth, health and prosperity. So, starting with the topic, we have fever today. So, fever, you might think, is a simple topic, but it is of huge importance in the medicinal field. It may be the sign or maybe the symptom, but the basic feature of any disease or most of the disease is the fever. So, let's see what are the types of fever, what are the grades of fever, what are the important features, or what we should see when a patient comes with a fever and what care we can give. So, what is fever? Fever is a state of elevated core temperature, or in the medical field or in the hospital, we see the surface temperature. Okay, there are two difference, that is core temperature and surface temperature. So, what is core temperature? Core temperature is inside the body. Okay, whatever we see inside the body, and uh, it is the temperature of any organ, that is 100 degree Fahrenheit. Okay, and surface temperature is about the temperature we see or we measure outside or surface of the body. Okay, so that is 98.6 degree Fahrenheit. So here, a state of elevated core temperature, which is often but not necessarily part of the defensive response of multicellular organism to invasion by live or microorganism or inanimate matter recognized as pathogenic or alien by the host. So this is a response produced by the human body. Any foreign object, such as living or non-living or microorganism or anything which enters human body recognize it as a foreign body and starts attack it like a soldier. So during the process, reaction occurs, the temperature increases, the temperature is increased temperature is called as fever. Okay, so it is a sign of a disease. It is not a disease, but it is a sign of disease. The temperature which raises above 99 degree is always termed as fever. Okay, so what are the causes of fever? Sometimes there will be an infection or malignancy. There will be a crushing injury from any accident or any fall. There would be an surgical trauma, heat stroke that is seen recently in a huge number, and also dehydration. And at last is a allergic reaction. Allergic reaction is a body's own mechanism where uh, the even for a normal object or a things, you will produce a uh, body mechanism, like fighting back mechanism, that is called as allergic reactions. Okay, so what are the phases of fever? There are three phases of fever, that is fastigium, stadium, or decline. So by temperature is going up and the time going forward, we measure this three phases of fever. So, what are these phases? First one was onset or invasion phase, where microorganism enters and all the fighting back like a soldier starts, and the temperature increases, that is fever starts and increase. The next one is, it will be in the peak level, but temperature will be at constant level and maximum. Okay, the temperature rises up and stays in the constant level. That is, this is the onset and this is the fastigium or stadium. Okay, and the third one is defervescence or decline, where sudden and fast or slowly temperature reduces. Okay, so this is the defervescence or decline stage. So the crisis of are of two types. What is crisis? Actually here it is the temperature are reducing very fast, like two types: true crisis and false crisis. In the true crisis, when the temperature reduces very fast, it also will lead to improvement in the patient condition, and temperature also will decrease very fast. And false crisis means here there is no any improvement in the patient's condition, but temperature will decrease suddenly, so it is of no use. If the patient's temperature is not if the temperature is reducing but the condition is not improving, then it is of no use. Okay, so that is called as false crisis. So what was the second one? First one was crisis and second one was lysis. So what is lysis? Lysis means fever slows a fever reduces very slowly and becomes the normal. That is called as lysis. These are the phases of fever. So next one is grades of fever. Grades of fever, here we have mild, that is very reduced, like from 98.6 to 99. That is very mild fever. It is negligible. Okay, that is mild fever. And second one is low pyrexia, that starts from 99 degree to 100 degree Fahrenheit. Okay, that is low pyrexia. And the third one is moderate pyrexia, where the temperature will be between 100 degree to 103 degree Fahrenheit. And the fourth one is hypyrexia, that is 103 degree to 105 degree Fahrenheit. And the last one is the dangerous one, that is hyperpyrexia or hyperthermia, that is more than 105 degree Fahrenheit, where the patient will start feeling the febrile seizure. Okay, the patient might be having, in the children's cases it is seen maximum, like if the patients are in fever is increasing more than 105 degree, it will turn into febrile illness to febrile seizure. Okay, that those are the grades of fever, that is mild, low pyrexia, moderate pyrexia, high pyrexia, and hyperpyrexia. So the next one is about hypothermia. We'll see in this only what is hypothermia. Hypothermia means it's the temperature less than the normal temperature, that is less than the 98.6 degree or less than 95 degree. Okay, here we see mild hypothermia. The first one is mild hypothermia, that is from 90 to 95 degree Fahrenheit. And second one is moderate hypothermia, it is between 86 to 90 degree Fahrenheit. And next one is severe hypothermia, that is less than 86 degree Fahrenheit. The hypothermia itself is one of the important topic that will deal in the next class, but this is just for your uh, little understanding. Okay, so what is that hypothermia? So next we'll see what are the types of fever. So first one is constant or continuous fever. Here the fever will be sustained with slight diurnal variation, that is less than 2 degree Celsius to or 3.6 degree Fahrenheit, that is less than 2 degrees Celsius or 3.6 degree Fahrenheit. Okay, that is a typing mistake, but you can understand here. It is like a scarlet fever or typhus or pneumonia. You will see these diurnal variation in these diseases too. So In the morning to evening, if you check the variation of the temperature, it will be very negligible, like 2 degree Celsius or 3.6 degree Fahrenheit. Okay, that is the constant or continuous fever. Next one is remittent fever. Here, pattern of fever that varies over a 24-hour period will be more than 2 degrees Celsius. Okay, in the constant it was less than 2 degree or 2 degrees Celsius, but in the remittent fever it is more than 2 degrees Celsius if you take the temperature of evening and morning temperature. Okay, uh, but it will never return to normal in the same day. Like, it doesn't return to the normal on same day. You need major medications to reduce it. Okay, if the temperature of, or the diurnal temperature variation is more than 2 degrees Celsius, then it is called as remittent fever. Next one is intermittent fever, or also called as quotidian. Okay, quotidian. Here, temperature rises from normal or subnormal to high and back at regular interval. Okay, the remittent fever will be having the graph will be like this. Temperature rises from normal to, this is like a, this is, this is x and y. Here, this is the normal. From normal or to subnormal, it will reach the high and back at regular interval. Okay, it will back at regular interval, that is higher temperature in evening and lower in the mornings. Okay, it reduces, comes back, reduces. This is like an intermittent fever. Okay, it never goes below the normal level. Okay, so a fever in which symptoms disappear completely between paroxysms, that is an exacerbation of the symptoms of a disease. It's like a sudden reduction or sudden increase of the temperature when you check the diurnal temperature from morning to evening. It will be normal, suddenly it will be increasing, again it will be normal, again it is increasing. Okay, so that was about the intermittent fever. Next one is about the inverse, that is highest temperature in morning and lowest in evening. Okay, highest will be in the morning and lowest will be in the evening. That is called as inverse fever. Okay, and hectic or swinging fever is also called a difference between high and low temperature is very high. Okay, see, the temperature, high temperature will be around 103 degree temperature and lower temperature is 99 degrees temperature. So the difference is very high, that is called as hectic or swinging fever. You might be seeing the swings here. See, this is a swing. Here somebody is sitting. Okay, so it is going up, suddenly coming down. So what is the difference here? Angle, if you check, what's the difference angle? So that is the range of hectic or swinging fever. It will be swinging, it will be reaching very high, suddenly it will reaching the very low conditions. Okay, next is irregular fever. Here, fever is completely irregular, so cannot classify into any group of fever mentioned above. Okay, the irregular fever here, it cannot be like put into any of the previous types of fever. Okay, so one more is fever of unknown origin. Here, whatever diagnosis you make, however the symptom is, you will never find the cause of the fever, how the fever came, what is the reason, what is the cause, you will never know. That is called fever of unknown origin. Here, an illness of at least 3 weeks duration with fever exceeding 38.3 degrees Celsius on several occasions and diagnosis not established after 1 week of hospital investigation. Even after 1 week, you are not finding the cause of the fever, then it is termed as fever of unknown origin. So those are the types of fever. Next, we'll see what are the pathophysiology, why the fever comes. Let's see now. So, fever occur by resetting a temperature regulating center of hypothalamus. So, hypothalamus is a temperature control center, or also called as the center where the temperature can be regulated. Okay, so, fever occur by resetting a temperature regulating center of hypothalamus at a higher level, that is higher than 98 point degree Fahrenheit, by the release of interleukin. Those are the chemicals, interleukin 1, interleukin 2, and tumor necrosis factor, that is also called a TNF, tumor necrosis factor from white blood cells, especially macrophages. These white blood cells are the reason why the reaction occurs and why the temperature increases. So that is the pathophysiology, where the hypothalamus is get regulated or get uh, like it gets activated when the release of interleukin 1 and interleukin 2 takes place by the chemical produced by the macrophages when the any foreign object enters the body. So to kill that, the body will increase the temperature. That's why we have the fever. Okay, so here the important topic in fever is rigor. Okay, rigor, it is sudden paroxysmal shaking chill occurring during a febrile illness. Okay, sudden you will feel the chill, sudden fever will occur, you will be sweating sometime, you will be very hot sometime. That is called as rigor. Okay, it is mainly seen in the malaria fever. And during the rigor, you are to since you will be shivering very rapidly and hot stage, cold stage during this time, to uh, regulate or oxygen level or to control the respiration, you will start hyperventilating. You will breathe very fast, you will be swallowing like large amount of oxygen. So that time what happens is, due to hyperventilation, you will be having the respiratory alkalosis. Okay, that is due to the hyperventilation. And what are the stages of rigor? These are the stages of rigor. Here you see the first one is cold stage or chill or rigor stage. Here the patient will start shivering and he will be shivering like anything, and there will be a tachycardia too. What is tachycardia? Just comment in the comment section. So uncontrolled shivering and tachycardia occur in this stage. Body feels cool and temperature rises to 103 degree Fahrenheit or more. Okay, body will be cool, but suddenly you will, like when you check the temperature, it will be more than 103 degree Fahrenheit or more. So you need to cover the patient with warm blankets and give warm drinks so that he gets warmed and shivering stops, and in return temperature may go down. Okay, so next one is the hot stage, also called as febrile stage or fever stage. First one was shivering stage, now is the febrile stage. Here the patient stop shivering and patient become hot, dry, restlessness and thirsty. Since the shivering, you will have a sweating stage later, but here since the fever increases, patient will feel very hot, and due to the evaporation of the body fluid, you will have a dryness, restlessness because of dehydration, and thirsty because of again dehydration. Here temperature increases continuously what you should do, you should remove all the blankets and give cold drinks and cold compression. Okay, and temperature may go up to or above 105 degree Fahrenheit. So you should start cold sponging. Okay, cold sponging or cold compression you can start. Next one is sweating stage. Here, this is a very dangerous stage because patient may go for dehydration very fast. So dangerous stage because a patient may go into shock if not cared properly. Shock because of dehydration. Patient will be sweating like anything, and fluid evaporation takes place, and intracellular or extracellular fluid will be reduced. So this will lead to shock. Excessive diaphoresis with decreasing temperature and improving pulse of the patient. Improving or increasing pulse of the patient. Why the pulse is increasing? Because since the body fluid is reduced because of the sweating, you will to replace the fluid, you will start the heart or a body will start pumping the blood very fast, so the increase in the pulse rate, but temperature will be reduced. There is no problem with the temperature, but pulse is increasing. Okay, so what you should do, you should dry the patient and give more fluid. How much ever is possible, give more fluid. That's too with, if you add light salt and sugar, that is, it's like a ors. If you give, it's more good, because there will, with the fluid loss, there will be loss of all the minerals. Okay, so that is what at the sweating stage. Those are the stages of rigor. And what care you can give to the patient is, you give sweet drinks. Okay, sweet drinks to treat fatigue. Patient will be sweating and fever and cold stage, everything. Patient will be in the fatigue stage or weakness, so you should give sweet drinks. Temperature should be recorded at every 10 to 15 minutes interval in the rigor. Even in the, if the patient is in the ICU or in ICU, PICU, anyway, you should measure the temperature every 10 to 15 minutes. Okay, and if the patient is having the neurogenic fever, you should start with the cold therapy than any antipyretic drugs. There is no uh, much response to any antipyretic drugs like paracetamol, so you should start with the cold therapy. Okay, cold compression, and maintain the body temperature with whatever regulation method you have in the hospital or in the home care too. Okay, so that's all about the fever. Let's see in, let's meet in the next class. Thank you until then.